Hey, we are talking marketing this week on Ask Allison. So here's today's question. Do you have any tips on the do's and don'ts for getting referrals from primary care providers? So first I want to thank Therapy Notes for sponsoring us. So we're going to do 3 do's and 3 don'ts. Do, start easy. You don't have to be a hero. Talk to the providers you already have a relationship with. So your PCP, your kid's PCP if you work with kids or new parents. Do collaborate with your clients' providers, especially if they're prescribing any psych meds. Primary care providers prescribe the majority of SSRIs in our country, if you're in the US. And so it makes sense that probably the majority of your clients who are on any sort of psych med are getting them from their PCP. So it makes sense too clinically to reach out and have a relationship with this person where you're collaborating for the benefit of your client. It's one of those things that's best practices clinically and can really benefit our referrals because we stay top of mind and the PCPs get to see that you're doing great work when they check in with their patient, and your client / their patient is like, oh my gosh, I'm having so many breakthroughs, or I've really been able to change this symptom or whatever. I have a template for these consult letters that you can just send snail mail once you have a relationship with people in the Abundance Party at abundanceparty.com. Third do build a relationship with the referral coordinator of the doctor's office. They're responsible for the majority of referrals coming out of the doctor's offices, particularly if the provider doesn't have a referral in mind. Make sure they're really clear on who a great referral is for you and who isn't. And if you're willing to be a resource for this person, then you're going to be just gold to them. Don't forget, I'm going to get into the don'ts. Watch out. I think that's all I had to say about that. Yeah. So don't forget, here's a don't forget that you have the opportunity to make the lives easier at these practices. Primary care providers want to take great care of their patients just like we do, but they only have 15 minutes to do so, and they're not experts in the things we're experts in. So being able to support their patients by handing them off to a specialist that they trust, that's you, helps them do their job better. So part of it is that's a mindset thing that I want you to take into this, because many of us feel intimidated by doctors or just healthcare folks in general. We need to get rid of that mindset. We're specialists. They're specialists in the things that they've learned. Please don't just mail cards, brochures, rack cards to an office. I've literally seen that work for one person who was in a very rural town, and they're so desperate for therapists there that it caught the office manager's eye and it did not go into the recycling bin. Almost everywhere else, it's going to go into the recycling bin. Do not waste your money on those materials or the stamps. Don't think that you have to get referrals from medical providers to have a thriving practice. It can totally help, but it absolutely isn't necessary. And I would say that the majority of successful practices don't rely on relationships with PCPs to get and to stay full. So I don't want you to assume that you have to do this if this is not a thing you want to do. That's what I got for you, your 3 do's or 3 don'ts. I hope that that's helpful. If you guys have a question for Ask Allison, send me an email, ask@abundancepracticebuilding.com. Take care.